My name is Parham Davoudpour. I'm an emergency physician at Humber River Hospital. I've been practicing emergency medicine since October 2017, so almost for 6 years now. My day-to-day role involves around seeing a variety of different patients. Generally, my role is to provide acute care, but again, we have a very diverse group of patients from simple injuries all the way to life-threatening medical conditions, and you cater to a large variety of different patients. I'm also involved with teaching. We have medical students and residents, and at my spare time, I involve with administration side of medicine as well. It goes back to my childhood. As a child, I used to get gifts, toys for my birthday or other occasions, and more interesting than playing with those gifts or toys, I used to open them all the way up and unscrew them, and before you know it, I'm looking inside to see how it works, and sometimes being creative and coming up with my own toy at the same time. So I believe that curiosity was extended later on in my life to human body and physiology, and that led me to medical school. And I started my training originally in surgical training or residency, and later on I moved to emergency medicine. As an emergency doctor, you get to see a wide variety of different illnesses, and at the same time you see a variety of different backgrounds, from ethnicity, cultures to socioeconomic class, and that makes my job very interesting for this dynamic relationship that you have with the patients. And at the same time, you have a wide variety of different teams around you, from nurses to other allied health care workers and RTs and EMS and everybody else around you. So that makes the environment very, very dynamic and engaging. And another satisfying part of our job is that it usually gives us enough spare time to indulge in other activities as well. And I have many colleagues and friends who are marathon runners, or they're Ironmans, or they're pilots, and you get to enjoy some of your hobbies as well when you're also doing full-time emergency practice. So I think for that reason, emergency is very, very satisfying. I believe Humber is very unique in a sense that from outside, you have this beautiful, shiny new hospital with all the technology and advancements. And from inside, you have this group of healthcare providers that are very compassionate and very kind, and they're pushing the envelope to provide the best care possible to the community and serve others. And that makes Humber very unique. Because now on one side you have the highest value of humanity, which is compassion, and you combine that with the advanced technology, and that, in my opinion, paves the road to the future. Emergency medicine at Humber has gone through a lot of evolution, I would say, over years, even before I started working at Humber. So we had the old days that you had only one emergency doctor who was running the department with maybe a few nurses and nothing else. And now we are down to the point that emergency department has its own ecosystem with a lot of doctors simultaneously working, and now we have technology, and we have ultrasound, point of care diagnostics. So it has transformed over years to a full-fledged department as a very important part of a bigger ecosystem, which is the entire hospital. So I usually refer to emergency department as the gatekeepers for the hospital. And in reality, we tend to get around 50% or even higher percentage of patients who are getting admitted to the hospital coming through emergency. So for that reason, emergency department and emergency medicine has become a very essential part of medicine in general.